change in any of the practices is constant now. We've got so much of the CQC dictating how service is delivered. We've got old premises. They are not now meeting regulations. We have to try and understand what is expected of our health service, and to deliver that we need to have professionals advising doctors in how their premises and their properties are actually coming to meet those requirements. We've got quite an interesting dynamic now. We've got a lot of medical centres, which is the standard old family GP. Now we've got this completely changing role and position of a GP in our society, and with that the level of expectation of the patients is becoming very demanding. Now we've got to try and get back some of the primary care function into the GP facility. Now you can't do that in an outdated, undersized surgery. So we've now got to start looking at pulling together through federation and through working together with other practices, because a small GP practice of 3,000-4,000 patients is not economically viable. But now we're trying to pull together a bunch of these surgeries and put them into a larger facility. Now the skill really is to try and keep the family feel. So you've got your family GP, you've got your family style, house style as it were, and if you can deliver that but in a bigger facility, so you've got possibly 3 surgeries coming onto a site, but each of the surgery practices function a slightly different way. They attract a different type of patient, they cater for a different type of patient. Now on some of these sites where we've got 3 GPs, possibly 3G practice, we might be up to 30,000 patients in a facility like that, we are then able to possibly put a step up, step down care facility, might be 20-30 beds. We are having a much higher triaging type assessment of a patient. We're getting a number of surgeries, they're getting a pharmacist coming in and dealing with a lot of the drug reviews. So the GP's time is freed up to actually do what the GP is best at, and that is dealing with the more detailed, more technical side of our community's health. A lot of the buildings aren't capable of adapting to the future. The site is too small, the car parking is inappropriate, they are located in an inappropriate space. If we're going to invest a huge amount of the community's money in developing a surgery and providing a facility for the community, we must ensure that with the changing needs in our society and the changing demographic and the changing size of the population of the area, we have the capability of meeting the requirement now and have the capability to deliver that service in the future. If you're thinking that you need a new surgery or you have not got enough space and you'd like an extension, possibly an extension isn't necessarily the best thing, the best way of spending money. Possibly you need to think a little bit bigger, but for the longer term, and actually saying, right, we want real value for money. I mean, it's a wonderful phrase, value for money, but real value for money is looking at delivering a service of a generational nature. Now, that is a conversation with people who understand property, that is a conversation with people who understand medical property. It's a conversation with accountants, with planners, with the whole team, and that's what we do. We bring together a team. It's not just about us, it's about bringing together a team, understanding the aspirations of the people who we're working with, and trying to actually give them the ability to really look into the future. They may be retiring in 4 years' time, but they most probably have got quite a lot of collateral within their environment because they've lived with it. These people who come and see them with their ailments, they'll most probably know their mum, their kids, their granny, and things like that. And you actually want to look after them for the future.